Hi everyone, welcome to the 41st episode of Battles and Voices. I'm Lathika and I'm the founder and host.
And I'm Camden, and I'm the co host, and we serve on the executive team of Vitals and Voices.
Battles and Voices brings together generations of people involved in healthcare in order to foster a supportive and inclusive community.
Now, please welcome our guest, Allison.
For having me.
Of course, thank you so much for being a part of this episode, and we're so excited to have you join us on Battles and Voices. To start off, could you please introduce yourself and share a little bit about what you do?
Yeah. So I'm Allison Makovec. I'm from Lee Summit, Missouri originally, but spent the last few years in Minneapolis, at the University of Minnesota, where I studied biology and anthropology. I recently moved back to Kansas City for the University of Kansas School of Medicine, where I am currently a first year MD PhD student.
That's amazing to hear. So, what inspired you to enter the healthcare field, and what does your current work look like as an MD/PhD student?
So I guess what inspired me was I always just kind of loved biology, but was also really interested in the social sciences. That's why I studied anthropology at University of Minnesota. And kind of throughout different classes and volunteer work, I was able to understand that healthcare really does sit at the intersection of the natural and social sciences. Since, when you have a clinical problem, you have to take into account the biology surrounding the situation, but also the more humanistic factors of the person sitting in front of you. So just kind of realizing that that field was at the overlap of all the things I wanted to know more about. That's kind of the initial inspiration of it all. And then right now, what I'm doing is I'm a first year MD PhD student. So doing all the same coursework as all other first year med students, but also staying busy with research, even though I'm not in the PhD phase yet. Still collaborating with both Minnesota and now the University of Kansas, doing a lot of clinical research based in oncology and public health.
That's amazing work. So, during your time at the University of Minnesota, you work closely with the Somali refugee community. Can you tell us more about that experience and what you learned from it?
Yeah. So what you're referring to is I took a class at Minnesota with kind of a small group of other people where we were encouraged to research a problem within our local community. And we found that our Somali population in Minneapolis had relatively high rates of cervical cancer compared to other populations. And that this was in part due to low screening rates. So we looked into why and found one of the main reasons being a lack of health education, especially for Somali refugees in Minnesota. So me and that group kind of came up with a health education initiative that utilized a web-based virtual clinic tour that also had information about women's health translated to Somali that could be both like read and then played aloud to listen to. And we put all of this into a mock-up website that we utilized the help of Somali student groups, Somali healthcare professionals, and Somali artists, all based in Minnesota, and won funding to pilot the project for a year. Surveyed women who had used the website and found that it received really positive feedback. So the big takeaway of that was just that not everything is 100% biology driven. I was doing this at the same time of taking a lot of those kind of pre-med requirements, a lot of science classes. So it was really pivotal in realizing the duality of medicine and that we should be tailoring resources to populations or even individuals for the best health outcomes.
That is some amazing work, and it sounds like you did a lot, and I'm glad that you did. So, we spoke a lot about the importance of education and transparency in healthcare, and why do you believe those factors are so critical for patient empowerment?
Yeah, I think it's just like to help people be involved in decision making. Medicine can sound like a really scary separate thing that people don't understand very well if you're not a part of healthcare. So I think it's just being able to translate some of that to people so that they can be a bigger part of their healthcare decisions. You know, we value personal autonomy so much in this country, and being able to exercise autonomy is being aware of what your options are, especially from an evidence-based medical perspective. So I think having that transparency helps guide patients towards the best outcomes that we can offer.
Definitely agree with you. So medical training and research can, of course, be incredibly challenging. What motivates you to keep going, especially during those difficult moments?
Good question. It's a long road, so you have to have something that motivates you. Um, for me, I think part of it is the research aspect kind of helps motivate both what I'm doing research-wise, but also what I'm training for clinically of just realizing how much is out there to still solve. Um, I think the deeper you get within research, the more you realize how little we know. So knowing that there's something always left to be doing across all aspects of clinical practice, there's always going to be more patients that need help. And then in the research side of, there's always going to be some kind of new therapy that we could develop to then help our physicians help our patients. So I think it's that never ending kind of cycle that um, really motivates me to keep going.
That's so beautiful to hear. I know we didn't jump into this, but you like briefly mentioned it. So you're deeply interested in oncology and cancer research, and what moments or experiences confirm that that was the field that you wanted to pursue later on?
Yeah. I had always been interested in genetics, which was part of that curiosity-driven aspect of me wanting to pursue oncology and cancer research. But I've also had immediate family members been diagnosed with cancer, so there's kind of also an emotional pull to that field as well. Um, the moment I realized I kind of really wanted to be in the field was working with just amazing people at University of Minnesota, such as Dr. Justin Wong and Dr. Nick Zorko. Those two people really helped show me from like a laboratory and clinical perspective how much the work we're doing really matters to people. Um, but then again, also helped me see just how much left there is to do. So I think I just really enjoy being a part of a group of people who are so dedicated to running towards the finish line that we can't even see yet, but definitely know is out there somewhere.
I really love that. And I love how you're helping so many patients and families with the research as well. So, you've worked on projects at the intersection of, and I might say this wrong, so feel free to, correct me, genomics, okay,
Genomics, yeah.
predictive modeling, and public health. Can you please explain why this area of research excites you so much as well?
Yeah. Um, so genomics, meaning working with like genetic data, DNA, RNA, that kind of stuff. Um, I think that mixed with we're in a really cool era of AI and technology that I think is helping us get closer to personalized medicine, to like precision therapeutics. Um, Current guidelines for treatments are usually based on population level research and trials. So we're going on what works for the most amount of people, but that doesn't necessarily mean what works for everyone. So I think this area of research really excites me because it gives us a really new, cool opportunity to start tailoring things to individuals so that we can really get at some of the best outcomes per person.
That's incredible. And I've personally never even heard of that type of field before. So that's intriguing to me too. So you're also involved with a startup focusing on improving prostate cancer outcomes. And how do you see that AI and predicted predictive models shaping the future of cancer care?
Great question. Um, yeah, like I said, it's kind of a really cool time to be sitting at the intersection of some of these developments. I'm currently working for a AI-based startup company called Emergence, spinning out from the University of Minnesota, that is focusing on how we can use genetic data to kind of predict cancer outcomes. So I think a big way that's going to start helping people is if we can start making treatments more personalized, like I mentioned earlier, and that helps treat people in the way that's going to provide the best outcome for a lot of different reasons. This can help us avoid over treating people or under treating people if we know the cancer has a high risk of being more aggressive or less aggressive. So then we can take those things into consideration right off the bat. And that helps from both a like side effect perspective of not all cancer drugs are super tolerable. So knowing if we can prescribe some of those less, if you're going to have a less aggressive cancer, things like that. But then also from a cost perspective of these things can be really expensive. So avoiding over treatment and under treatment if needed can help patients on so many different fronts. So I think that's going to be something that's really big moving forward.
I really love that. And yeah, I think AI is definitely used and can be used for the good in medicine and healthcare. I did like research summer of 2025 last year, and it was about how AI can help in like pediatric treatment. So,
Mhm.
we actually got the experience to kind of see how machine learning and those like different models can actually help, predict a patient's outcome and their well-being. So yeah, AI can definitely have some good uses as well. So one of your major accomplishments was your research on the gene CREB5 in breast cancer. Can you please tell us about that project and why it's so meaningful to you?
Yeah. So that gene, CRIB5, we found that it promoted more aggressive cancer types in breast cancer and was even specifically linked to breast cancer metastasizing to the brain, which is not a good thing. Um, and the biggest interesting finding throughout this project was that CRIB5 was also increased the expression of another gene called IL-13RA2. And that gene is currently being used, or the protein is currently being used as a target for new therapies in brain cancer. So the thought was maybe we could start utilizing some of these new drugs in certain types of breast cancer now, too. So things that definitely require a lot more studies going forward. But it just kind of introduced that idea, and it was something that a lot of people at Minnesota started getting excited about. And the biggest thing with this project personally was it took over 3 years to complete and publish, and a really large team of experts across the university. So this project was not only super gratifying from the standpoint of offering new clinical knowledge, but also helped me gain some more like communication skills, connections, and ability in leadership and project management, all things that have made continuing to do research while in med school a little bit easier.
Well, that is some amazing accomplishments right there. And now, over several years of leading that research, what skills or lessons did you gain that you think will stick with you throughout your whole career? Sorry.
Yeah. I think outside of some of the ones that I mentioned, a big one was probably patience, because that project took so long. It took so long because in the beginning we had quite a few things go wrong in the lab. So um, being able to learn how to troubleshoot rather than throwing your hands up and saying, you know what, I think we're good here. Um, that was definitely something I had to learn how to do and how to move forward productively with things that can be very challenging and very high level science. And I think that also helped maybe on a bigger scale with delayed gratification. That's something that, especially being in an MD PhD program, it's, 8 years of training to get both of those degrees. So you have to kind of be able to step back and look at what you want the bigger picture to be. And I think that's something that I learned throughout the course of this project for sure. So that would probably be the biggest thing.
Yes, I definitely have to agree with you again. And finally, to wrap things up, what advice would you give to students who are interested in pursuing a physician scientist path or even combining research with clinical care?
Yeah. Um, I think for like pre-meds interested in research or just trying to see more about it, I would say just try anything you're interested in. It can be very scary to start, um, especially at big universities with a lot of research going on. But I would encourage you to just reach out to people and really focus on what you can learn from those around you. I think the being like a pre-med student can sometimes feel like you need to constantly be stacking your CV at times and focus on publications and posters and awards and that side of research. But I think if you really focus on learning from the experts that you have around you and developing skills from those people, those other kind of shiny achievements will follow anyway. So I would say stay grounded in your interests and just do your best.
That is some beautiful advice, and thank you so much for sharing your journey and the passion that drives your work.
Thank you.
It's incredibly inspiring to hear how you're blending research, medicine, and patient advocacy to shape the future of healthcare.
And to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voices.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes of Battles and Voices.
We'll see you next time.